cord blood has different types of stem cells in different proportions. And currently, we determine only the total nucleated cells, or TNCs, and the hematopoietic stem cells, or HSCs, which have the cellular surface marker CD34. And this because they are used primarily in hematology oncology for reconstitution of bone marrow after high doses of chemotherapy. These immature HSC hematopoietic stem cells had no contact with antigens encountered by the growing child and may generate healthier white cells. So these cord blood cells are not primed for inflammation by various antigens, and in some cases the white cells primed by these various antigens, especially when are given simultaneously or the inflammation is very severe, can also produce autoantibodies, meaning antibodies which target own cells. And this is the case of autoimmune diseases. And in our study, we had detected in 2 children antibodies against neuronal antigens, SOX1 and amphiphysin. So this is one aspect. Cord blood also contains mesenchymal stem cells besides the hematopoietic ones, and these have 2 important beneficial characteristics for ASD. They can differentiate in many cell types, including neurons, and have important immunomodulatory properties, therefore reducing inflammation by decreasing the pro-inflammatory functions of white cells. And on this direction, we have tested the cord blood on the content and viability of hematopoietic stem cells and mesenchymal stem cells by determining the presence of surface markers CD45, CD34, CD133, and CD271, as well as 7-AAD. So we went beyond the standard of care. And importantly, there is a previous study done by Dr. Cucci in 2010, which showed that the proportion of CD133 positive, which is a marker for hematopoietic stem cells, and the CD271, which is the marker for mesenchymal stem cells, so the proportion between HSCs and MSCs determines the site of migration and implantation of mesenchymal stem cells, so that the 8:1 proportion favors lung implantation and 1:1 proportion favors brain implantation.
Okay.
This is an important detail. Some cord blood grafts contain stem cells with embryonic markers, NANOG and SOX and OCT, which are even more capable of division and differentiation into many cell types and are able to replace the neurons destroyed in ASD. This testing is not currently done, and we are trying in the future to expand our capabilities to include this aspect. Finally, the cryogenation of cord blood involves the presence of a special substance, the dimethyl sulfoxide or DMSO.
Okay.
And this has anti-inflammatory properties, also protective effects on the neurons, and promotes preferential differentiations of mesenchymal stem cells into neurons, multiple advantages. So the administration of cord blood harvested at birth and cryopreserved in DMSO, as opposed to fresh cord blood, has this added benefit.
Okay.
And in summary, decreasing inflammation, the paracrine neurotrophic actions, and providing neuronal precursors are 3 important therapeutic directions addressed by cord blood in ASD.